Well, I think cash transfer has been around for some years, and I would say at least 5 years ago this was an issue, or became a little more prominent in this country. And I think now it has become even more and more important.
I'm not sure I can trace it to one particular event or date or intervention.
I think it was many decades ago actually. Well, government policy on cash transfers has been very inconsistent.
Most people think that it has come out in debate only in the context of the food security thing. It's a very, very old exercise, and we have many cash transfers which are currently going on. I mean, all the social pensions in that sense are cash transfers, whether you're a widow pension, old age pension, or your social disability pension. Even your scholarships are cash transfers. All forms of scholarships are cash transfer. So we have an existing method, I mean, we have an existing model, and cash transfers have existed for quite a long time.
In terms of food security, it's really very recent. It's just come. It's come now.
Well, government policy on cash transfers has been very inconsistent, and the government itself has been has talked about it in a very divided way. So I think there have been documents from the Planning Commission or the Finance Ministry which have talked about the use of cash transfers, but it's never found. It's never been implemented on. So the implementing agencies, like the line ministries, like the Food and Civil Supplies Ministry, they have never engaged with this seriously at all. And so government policy, you can't think of government policy as it's a bit of a confused picture. I mean, there's people are debating it within the government itself, and so the UPA, I would say, there was no in the first UPA government, there was no discussion about it at all. The whole debate started in the context of the National Food Security Bill, there was a lot of debate about it. And as you know, that bill took many years to, maybe 2, 3, 4 years for it to be formulated, drafted, the laws. And during that time, there was a lot of debate. And so at that time, there was a lot of debate about it. So what finally happened in the NFSA is well known.
And that is what the unfortunate part is, that it came up only when the food security bill was being discussed, as if this was being suggested as an alternative to the whole FCI and the PDS kind of an exercise.
In a sense, the PDS has been a part of our history. I mean, I think it got introduced in 1944 and we sort of continued it. And in 1997, we then had that BPL, APL, the TPDS being brought in. So, and until the TPDS came in, remember we had a universal public distribution system. At that stage, the notion of cash transfers simply didn't come in because it didn't make sense. Because then what you would have to do is to give a cash transfer to every household, right? It would be just easier for you to reduce the price in the PDS a little bit and leave it at that. Okay? It starts getting relevant when you have something like the TPDS, where you're drawing a distinction between the BPL and the APL, and you're putting a sizable wedge in the prices that the two are paying in the PDS system. Okay? Now, when you do that, what happens is you automatically create an incentive for diversion. If you have a universal system, there will be some diversion to the open market, but it won't be that large. When you have a system where there is a certain amount of food that is at essentially 1/3 the market price or even less, then there's a huge incentive to divert. Now, if there is diversion, then the beneficiary is actually not getting what he should. Right? That's when the cash transfer comes and starts becoming meaningful. Saying that, look, we know that diversion is going to happen if I have a differential price. So why don't I just give the guy the cash, have a uniform price, and let him go buy it? So for the supplier, he does not distinguish between the BPL and the APL. Right? So this is a post-TPDS sort of development. So it didn't even begin in 97. TPDS began in 97. So this started sometime in the UPA 1 regime. The discussion started happening.
Well, I'll talk about the Indian context because a lot of these arguments are specific to the context. In the Indian context, we have had the public distribution system even before India's independence, actually. It's a very old system. And for decades and decades, we've had this policy. And for decades and decades, it did not have appreciable impacts on anything, except that we spent a lot of money. And so I think in the Indian context, the arguments, original arguments, are mainly that perhaps the in-kind transfers that we have are being wastefully used. Perhaps we can do a better way by using food coupons or food stamps. Cash transfers in Indian context have been talked only very recently since the debate about the NFSA, the National Food Security Act. But there was a lot of talk about food coupons and food vouchers. And in fact, the Planning Commission itself had brought out a paper on this issue before the NFSA itself. So there was awareness about this, and essentially from the point of view of that it is possibly a system that potentially would have less issues with corruption and wastage.
What happens is that the public distribution system did have very serious implementation issues in almost the entire country, barring Tamil Nadu.
There's a lot of leakages. One also noted that after every rupee the government spent, the effective income transfer to the poor was only 15 rupees, 15 paise or 20 paise, which is what few months ago before which is what Rajiv Gandhi had also said.
In the 80s or 90s, the international lending agencies, when they were advising developing country governments, they sometimes used to advise that food subsidies should be replaced by cash transfers. Unfortunately, that gave cash transfers a very bad name because it was not implemented very well, and the whole idea was to have cash transfers without any indexation, so it was not indexed to prices, and in some sense the policy objective, whether it was articulated or not, was to reduce the subsidies. Okay, so it was done with that motivation. It was not done with improving the efficiency with which subsidies delivered or improving the extent to which households can access the subsidy. Then, of course, starting from the mid-90s or late 90s, and now cash transfers have come into fore because of their use in Latin America, and there they are called conditional cash transfers because it's not linked to food subsidy as such. Food subsidy programs, by the way, have vanished. In-kind food subsidies in many countries. China used to have a very extensive one. It's much less. Latin America used to have one. Mexico used to have one. The corn tortilla program, that's now really reduced or gone. Instead, what those countries have invested are these cash transfer programs, which are linked to a household's enrollment of their kids in education or attendance of various health checkups and so on and so forth. And because of the success of those policies, it's really become a big issue worldwide.
Especially Bolsa Familia in Brazil, which is actually a conditional cash transfer, and basically what they say is that if you send your child to school, we'll give you cash. Yeah, if you go and immunize your child at the public health center, then we'll give you cash. So it was to incentivize people to do things that they would even otherwise want to do. Yeah, so it wasn't really a replacement of public services with cash, but it was to encourage people to use public services also. So in India, somehow this idea, and actually it had been used in a particular way in Brazil as well, where they had wound down, and in Mexico, that's the other big one, where they wound down the food subsidy and replaced it with cash. So that's how the idea came, that here we have a public distribution system, PDS, which doesn't really function, and all these countries are successfully implementing cash transfers, and selectively some of that evidence entered the debates in India, and so it seemed like a really good idea.
Way back in the time of Narsingh Rao, I was a member of his Economic Advisory Council, and there was a concern about how PDS is working, and he asked the question, and we said it's not working properly. Then he says, give me a note, and I said, let me look, within 2-3 months we'll give a note. We did a study of the national sample survey rounds, which had asked the question, people, how much food you are consuming, how much are you getting for PDS, how much you are paying for that, how much you are buying from market, and what's the price of it. All these questions were asked. So we analyzed these things, and I did an analysis of this and showed that in almost all states, everywhere, the poorest people, the bottom 30% of the people did not get, half of them did not have access to PDS, and that the amount of food grains they were getting was 2 to 3 kilograms per person per month. And if you again look at what is the actual value of that food grains, so I looked at the price they were paying for that food grains, and the same household or the same class of poor class household, same decile household, buying food grains from market, and the difference between that and the quantity would be considered as the real net income transfer to these people. So if you look at the net income transfer from cereals, it came out to be less than 3 rupees per person per month in almost all states. And if you and considering that this is for those who are buying food grains from the PDS, half of them were not even accessing PDS. And so if you look at all this, one would be argued that 1 days of additional employment at 15 rupees per person per month would really be equivalent to the amount of food grains you are transferring. So there was a question that yes, we should really improve this or give more employment guarantee scheme kind of thing, which was then going in Maharashtra, would be the much better way of providing income support to the poor than this PDS, which is a lot of leakages.
What had happened is that around 2005, there was a Planning Commission report which documented 50% leakages in the PDS. That report was based on data collected between 1997 and 2001. Yeah, and that report was still being used in 2000, even today, in fact, in 2014, if you are favorably inclined to cash transfers, then the data you will use is from that 2005 report, which is based on data from until 2001. What has happened, however, since 2004 onwards is that many states have started taking an interest in the public distribution system and also started fixing it. So even in states where it was completely defunct and 80%, 90% of the grain was getting siphoned off or being sold onto the open market rather than being given to people who had ration cards, they've been able to fix their systems. Yeah, so between 2004 and 2007-8, states like Chhattisgarh and Orissa especially have seen a massive turnaround in the PDS.
Around that time at IGIDR, we did a study also on kerosene, and we had recommended that you should use a smart card based system to give kerosene, which was like the same kind of an idea that people are talking about, cash transfer, that you say give people a smart card with an entitlement of 5 liters of kerosene. They pay full price at the market, buying from anybody, and the rest of it get transferred from the government account to the trader's account under that smart card scheme.
And then on top of that, in the past, I think since about 2008, this idea of Aadhaar and UID also entered the cooking pot, so to speak, and then they all stirred up a big storm.
Then I think when the Aadhaar idea came, that was really, in a sense, a clear breakthrough, because what happened was that we means the country has been talking about having a unique identification number for every person, and there are a number of committees had been set up. What should the number include? What digit should give what kind of information they should have? And they would always argue. One fellow says, no, this it should be there, age should be there, location should be there, this, another thing. And all that, they would never arrive at a consensus as to what should be done, and it never really went further. Comes Nandan Nilekani with I think, a brilliant idea, and it was also possible because the whole IT system, the scheme in the country had changed dramatically. So here he comes and says, well, I'll give you a random number to everyone, but I have all the other details on my card, and we will have fingerprints and iris measurement, so it will be unique. So it was a unique and a simple and identification number that is being given under Aadhaar card. That is the great advantage, that it will virtually eliminate any ghost cards. And we know that in most, wherever people have targeted public distribution system or give a lot of subsidies on this, there are more cards than families and things of that kind. Even in Chhattisgarh, that is the case today.